Dementia is extremely harmful to everybody, including the patient, the family, as well as the society. The family has to put a lot of effort in caring for the patient, and the government has to fund the facilities and the individuals. Unless it is the early stage, dementia is very difficult to reverse. Some people call it another form of cancer for its indefinite morbidity. What's the reason that our society gets more and more dementia? It is a modern issue in many of the cases. The number one cause of dementia is vascular dementia, which is due to the partial obstruction of the arteries that supply blood to the brain. This results in the less than optimum level of blood irrigation to the brain. It's called hypoxia when the brain cells doesn't get enough oxygen from the blood. Chronic hypoxia leads to vascular dementia. The cause of vascular dementia is atherosclerosis, which is a fatty plaques buildup in the inner layer of vessels. Biopsy and autopsy results show that atherosclerosis starts from as early as the teenage years. This is a process of aging which is not reversible. It's just a matter of how fast or slow the aging is going, as well as aging in a healthy way. So how to make the brain aging healthily? The common recommendation of vegetable and fruits, chicken and fish, plus exercise are not enough. 60 to 70% of the brain is fat. Intentional avoidance of fat in the diet is not what the brain lacks. In many of the longevity nations and countries, their diet always contains a significant amount of fat. Therefore, fat is not the issue. What matters is the quality of the fat. We want the natural form of fat. Nowadays, there are so many different kinds of fat on the market, especially many kinds of artificial fats and processed fats. These fats are the main reason of atherosclerosis, since these fats cause inflammation. In order to form plaques, fat is not the only factor. It is the inflammation that makes the fat stay there and form plaques. The mechanism of atherosclerosis is very profound, and humans still don't know a lot about it. Efforts of making a drug for the prevention and treatment of atherosclerosis haven't been successful. Lipid-lowering pills is a very passive way of preventing and treating atherosclerosis. Since the data of different trials are very conflicting regarding how much benefits are these pills. However, that's the routine practice of many places. The fact that those nations with a high-fat diet with a very healthy aging are ignored. In these populations, high-fat diets are safe when the inflammation levels are low. The number one reason for the high inflammation level is sugar. Before the industrialization, sugar was difficult to get. But nowadays, sugar is in everything on the shelves in the grocery stores, since it is such a cheap ingredient that makes the food taste good and make the people addicted. Besides sugar, there are also many other toxic molecules and chemicals in our food and the environment. The nervous system is very sensitive to the toxicities. The chemical in cells turns into a chain of chemical reaction cascade, and becomes emotional change as well as mental change. The damage in the nervous system is hard to reverse, since the neuron cells cannot regenerate. And since it can't regenerate, the toxicities keep accumulating. One of the accumulations in biological bodies are the plastic particles. They are in the nervous system of the fish from the deep oceans. These artificial chemicals may not kill the brain cells right away, but the damage keep accumulating and damage the brain function. We want to try to avoid any food in the plastic containers. In Asian countries, people sell food in plastic bags. Nobody considers it's harmful since everybody survives after eating food in it. It doesn't seem a problem at all. Similar things in the West are the coffee containers. Today we focused on the vascular dementia as well as dementia from potential chemicals and toxicities. In the continuing sessions, we're going to talk about Alzheimer and other forms of dementia, their causes and prevention. That's it for today. Thanks for listening and watching. See you next time.